Good morning, miss. Good morning, classmates. Today I'm going to talk about the endoscopy. The endoscopy is a non surgical procedure used to examine a person's digestive tract. Using an endoscope, a flexible tube with a light and a camera attached to it, your doctor can view pictures of your digestive tract on a color TV monitor. Unlike many other medical imaging techniques, endoscopes are inserted directly into the organ, which basically means that a very tiny camera, is introduced through your mouth to visualize the internal parts of your digestive tract. The principle, well, basically, fiber optic endoscopes use bundle of thin glass fibers to transmit light to and from the organ being viewed. These fibers use the principle of total internal reflection to transmit almost 100% of the light entering one to the end of the one end to the other end. Well, here we have the parts of an endoscope. We can see the light guide connector, which is on the top, the light guide tube, the flexible tube, the control body, and the internal instruments channels, the insertion tube, and the bending section. Yeah, here we have a picture of a stomach that is um, being explored by an endoscope. We can see that the endoscope was inserted through the mouth and keeps going until it reaches the stomach. Many of the endoscopes have on the at the end of it like a like a like a very tiny part, which its function is to grab a sample of the tissue of the stomach tissue to being examined, to deliver it to the laboratory to be examined. This is a cross-section view from the endoscope. We have the image guidelines, the light guidelines, the air water nozzle, and the opening biopsy channel. Here we have a schematic diagram of how endoscopy it works. We have the light source, the video processor, the pump, and the endoscope itself. What are the main risks of having an endoscope? Well, the risks are very low, but nevertheless, here are one of the most important. The main risks are infections, oversedation, perforation, or a tear of the stomach or the esophagus lining, and bleeding. Although perforation generally requires surgery, certain cases may be treated with antibiotics and intravenous fluids. Medical uses: investigation of symptoms, nausea, vomiting, abdominal pain, difficulty swallowing, and gastrointestinal bleeding. Confirmation of diagnosis like anemia, bleeding, inflammation, cancer of the digestive system. These are one of the types of endoscopy. The main popular ones like gastroscopy, colonoscopy, laparoscopy, proctoscopy, bronchoscopy, laryngoscopy, nasopharyngoscopy. The conclusion, well, um, the endoscopy is the endoscopy made the minimal blood loss surgery with increased rate of healing and with less pain. Endoscopy done because of patient expectations and the gastroenterologist's desire to provide the requested service. The thoracic surgery to remove a tumor located in the thoracic cavity and able to throughout thoroughly remove it by using an endoscopy. Thanks.